Hello, everybody. This is Gary. Today is Sunday, November 20th, 2022. It is 12:38 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Mentally, I'm doing fine. My anxiety levels are not very high. My auditory hallucinations are not that intense. My delusions and paranoia are not that bad. My depression is not that severe. Um, I think psychiatrically speaking, I'm pretty stable. I just took my noon meds. It's about 12:39 right now. I already went outside to do my daily walk and physical therapy exercises. It's very, very bitterly cold outside today and very, very windy. Winter is definitely approaching. There wasn't a whole lot of snow when I went outside in Rochester. I heard there was a snowstorm, I believe, in Buffalo, New York. We haven't gotten any of that snow yet, but we certainly have gotten a severe Arctic blast of cold air, and it's very windy outside. Um, it makes it more challenging for me to do my daily walks and exercises. I'm in a lot of physical pain right now. Both of my legs hurt really bad. And I kind of expected that to happen once the weather started getting colder. It always happens. The cold weather irritates my arthritis in my lower spine, my upper spine, the pain and muscle spasms in my legs, the pain in my right knee that I had surgery on May 13th earlier this year for a torn meniscus. I expected all that physical pain to get worse, and it certainly has gotten worse. Um, it's something I'm going to have to live throughout the winter. I do take pain medication, not opioid pain medications, but Neurontin for nerve pain and other types of pain. I take Flexeril for muscle pain in my back, muscle pain in my legs. I take Cymbalta for nerve pain, joint pain, arthritis pain, nerve pain, and I also take Motrin and Tylenol for pain. Um, Despite the pain, it's important that I continue to exercise every day, regardless of whether it's cold outside or not, regardless of whether it's snowing or not. Not exercising will only make my pain get even worse. Obviously, inactivity leads to things like obesity, which increases a person's weight, which puts more pressure on my legs. So, obviously, exercising every day is very important, whether I'm in pain or not, because not exercising, the pain will only get worse. But right now, physically, I feel like shit. I'm in a lot of pain. Um, and I'm still taking all the medications I'm supposed to be taking for that pain. Um, but um, Psychiatrically, I think I'm as stable as I can expect to be. I just took some Klonopin and did some meditation about 40 minutes ago after I took my noon meds. Um, it is getting colder out, and that makes things a little bit tougher. I'm just glad that I'm not homeless, that I have electricity, that I have heat, food, place to stay. There are a lot of people in Rochester, New York who are mentally ill and who are homeless. I learned a long time ago if I stop taking my medications, I become homeless. Yes, there are side effects to medications, but I would rather be in my apartment than outside when the present temperature, according to my computer, is it's about 4 degrees outside right now with the wind chill factor. So it's pretty cold out. And that irritates my physical pain, which can agitate my psychiatric symptoms. I suppose my depression will fluctuate over the winter. My anxiety will fluctuate over the winter. My paranoia, my delusions, my auditory hallucinations will all fluctuate throughout the winter. I tend to feel more crappy during the winter, but so do a lot of people. Everything from depression to psychosis can get worse, along with mood during the winter months. Um, Today is Sunday. On Wednesday, I have an appointment with my therapist, which is the day before Thanksgiving holiday here in uh, the United States. So once this Thursday comes, everything will be closed down for the holiday. Banks, medical clinics, whatever, everything will be closed. Both Thanksgiving Day, a lot of things will still be closed on Friday. A lot of stores will be open on Friday. And of course, the weekend will come. So we're talking about a 4-day weekend where a lot of things are going to be closed. And I'll have less access to my therapist because she obviously won't be in her clinic. She will be at home for the holidays. And that goes with my psychiatrist. I'm seeing my psychiatrist, I believe, on December 8th, and I'm seeing him once every 6 weeks. I'm seeing my therapist once every 2 weeks. I'm seeing my peer support specialist next week. I forget which day, I would have to look it up. But I'm seeing her every 2 weeks as well, just because physically and mentally, the winter is a much more difficult time for me. Um, the only thing I could do is continue to exercise, keep my daily schedule, take my medication, keep my appointments, and just be grateful for the things that I have. That's all for now.